and welcome everybody to this week's Maternity and Midwifery Hour. This is Series 10 and Session 3, and my name's Sue Macdonald, and I'm the curator for the Maternity and Midwifery Hour and the Maternity and Midwifery Festival, can't even say the word, festival, which is next week. Just a little forward warning there. And tonight is my pleasure to be chairing it's going to be a really interesting session. And I'm joined by three lovely speakers, and I'm only giving them an hour. They're only having an hour. And we have Mary Newburn, who many of you will know, who is Patient and Public Involvement Engagement Lead, King's College, London. Joe Daguston, who is an AIMS volunteer and public co-investigator, NIHR funded ELHT Project. I'm sure she's going to explain what that is. And Sina Barry, who's political scientist, international development specialist, and director, National Maternity Voices. So it's absolutely fantastic to have such a superb lineup this evening, but we're not going to let you escape without sharing your moment of the week. So please, could each of you come up with your moment of the week, and we'll start with Joe.
Thank you very much, Sue. Not a tricky one for me this week, actually, because over the weekend just gone, which I renamed Book Holiday Weekend, I picked up this book. Is that back to front? Can people see it? I'm not sure. I'll read out the title. It's The Enchanted April by Elizabeth von Arnim. And I was happily reading this novel when things kept jumping out at me about the transformation of maternity services. And I put in my notebook that I need to recommend this one to Sheena Byram in particular. So that was my moment of the week.
Wow. We're going to have more of that at a later point, Joe, because that I know you were tweeting about that, and my big thing was, I wonder if it's a book with a happy ending, because that's quite important to me.
Yes, it is.
That's fantastic. Okay, how about Zainab? Have you got a similarly good moment of the week to share with us?
Yes, good evening, everyone. It's a pleasure to be here. And yes, I've had a really good week, but I guess the highlight that I'll share today with you is when I volunteered at my son's school to help with some reading. It was really nice to listen to young children read and get a hug at the end. Really nice and heartwarming. That is the highlight that I wanted to share with you. Thank you.
Fantastic. That's a lovely highlight. Thank you so much. I love it. I've got a picture of a big hug and all that, the lovely reading going on. Fantastic. Thank you so much. And how about Mary?
Thank you very much, and good evening. It's lovely to be here. So one of the things that I spend quite a bit of time thinking about is succession planning and capacity building. And my moment of the week was having a lovely exchange on WhatsApp with one of the women who's a bit younger than me, who I mentor. And one of the lovely things about mentoring is actually I get at least as much back from the people that I mentor as I hope that they get from me. It's a real relationship, which is a nice theme because we're going to be talking about relational care.
Fantastic. And I bet there was a hug there too.
A virtual one.
A virtual
one. In fact, she said, "Mary, you crack me up," which it made me smile. So I got a virtual hug.
Oh, I love that. Okay, well, that's fantastic. And it's good that the sort of relational kind of theme that's just been seeded now. So thank you, Mary. That's fantastic. Now, I'm just going to remind people there might be some new people joining us this evening. We started in the pandemic, right at the beginning of the lockdown in the UK, because at that point, there were no conferences allowed, no study days allowed, no face-to-face activity. And people needed contact, people needed continued professional development, and people needed information about what was happening, and more information about COVID and the impact on maternity services. So we started the maternity hour, and we're still here. And what is great about this is everything is recorded. So if you miss anything, or you really, really like this, I'm sure you will really enjoy this evening, you might think, oh, what else? This is a bit like actually finding a new book by a new author, because you kind of think, oh, I wonder what else they've done. This would be really interesting. And if you go to the Matflix website, you'll find everything is recorded. Everything that Maternity and Midwifery Forum do is recorded. All the festivals, all the maternity and midwifery hours are done and recorded, and you can access them for free. If you want to access them more themed, with little reflective activities and additional content, all beautifully crafted by our lovely Dr. Jenny Hall, you can get a little subscription to the box set, and that's like a monthly subscription, and it's rather delicious. Very good if you're doing a project or dissertation, or you've got a lot of essay work, or you're looking at revalidation of midwives out there. So really helpful. But do share what you're learning from us. Have a discussion at work. That will help. Oh, I've got the revalidation on the brain, really, but it will help in you cementing what you're hearing and understanding it, and also expanding it out. So do share and enjoy. I want to say a big thank you, and I say this every week, and I really do mean it, because I know from my local midwives how hard people are working and how hard it is at the moment in the health service, full stop, because everyone's short of staff. There's a lot of stress with all the things that have gone on with the industrial actions and all that sort of thing, and it can feel very heavy and difficult. So a big thank you for you for carrying on and doing the things you're doing to make sure that women and babies get the best of care that they can get. And that's really fantastic. But also remember yourselves, remember to look after yourselves, because you're important too. And you're probably also balancing family and lots of home commitments in the way women, and most midwives are women, but of course there'll be some men there also doing the juggling with life and everything. And so look after yourselves at the same time. Now, news feature. I've only got a few minutes for this one. I want you to check out, and this is on your resources sheet, which has got lots and lots of references from this evening's session, but also some little extras like the May Action for Happiness. Anyone that knows me knows this is a big favourite of mine, and it gives you a little thing to do every day, something easy, not too complex. Today's, because it's the 10th, be grateful for the little things, even in difficult times. And I think that's a good one to have, because sometimes when you're really overburdened with stuff, you can forget that and lose your kind of reality check. So really nice, really good to keep on top of that one. Okay. There's also the nice intrapartum consultation, the labour consultation in progress. I'm sure that Mary and Joe and Zainab are also preparing their response to it. But do put your 10 penneth in if you have a look at it. And that, again, the link is on, it's also on that resources sheet. Okay, and there's a call from our lovely Jill Moncrief, who many of you also will know. She's running the Remain study into why midwives stay, why midwives leave, and it's ending at the weekend. We've also put 2 links on the resources sheet for that. So if you haven't participated, and maybe you were thinking about leaving, or maybe you actually left midwifery, Jill would really welcome your input into that project and your say so. Everything is really valued. So do have a go, and it's your chance. Also, we've got some bedtime reading. I always give you some, don't I? But this is, you remember we had Mari Harkness and Cassandra Yule speaking in series 9 about their induction project. Well, it's just been published. And again, there's a link to the research on the website, on the resources page, so do have a look at that. The other news is that Tommy's the Charity have just launched their 10-year strategy to really address the heartbreak and devastation of baby loss. and make pregnancy and birth safer. And that's, again, it's on the resources, and we'll be hearing a bit more about that next week, so more about that later. Okay, so I've hit 7:10, perfect timing here. So I'm just reiterating, we're joined by 3 fantastic guests this week. We've got very much a user focus this week on, and of course the woman and her baby and her family are the centre of our care and need to be at the centre, because if we keep them at the centre, actually we can't go much wrong. And I think when we lose that, that's when things go a bit wrong. So we're going to be looking at maternity services and what continuity care means for women and their families, and more about the Maternity Voices partnership, because I think that's really important for people to know about. So for the first bit, the first presentation, we've got a double act, and we've got Mary Newburn, and everybody knows Mary. She works from a service user perspective with maternity and perinatal mental health theme as part of the NIHR funded Applied Research Collaboration in South London, hosted at King's College. And this research, which you may or may not know about, addresses poorer health outcomes for socially disadvantaged women and babies and Black, Asian and minority ethnic groups. And she also convenes the Maternity Continuity Network, is a member of the NHS's England's Maternity Transformation Programme Stakeholder Council and Midwifery Continuity Care Research and Evaluation Subgroup. And she does a load more, and that's all available on the website also. And she is presenting with the lovely Jo Daguston, who's usually one of our participants. She's one of our most loyal participants, always comes up with really good questions and is really into working together with us. And she's a social geographer. I can't even say the word tonight, geography, and I can't do geography either. So that's probably the bottom of it. She's also an AIMS volunteer and also public co-investigator on the NIHR ELHT Project, and a very regular participant. So welcome to Mary and Jo, and the screen is now yours.
Thank you, Sue.
Thank you, Sue. I think our slides are going to appear in a moment.
I think they might well do.
Okay, so while they're coming up, just to say thank you to you, Sue, and to all of the team working on Midwifery Hour. It's really a joy to attend every week and to present tonight. So if we could, great, we've got our slides up now. So Mary and I are here tonight to talk about the Maternity Continuity Network and how the network is helping to organise third sector and service user voices in support of midwifery continuity of care. And just to put this into context, Sue, you mentioned that I was an AIMS volunteer, and AIMS, the Association for Improvements in the Maternity Services, is one of the UK organisations that has been campaigning for decades for relational care or continuity of care to become the bedrock of UK maternity service organisation for all women and families throughout their maternity journey. Now, as UK viewers will appreciate in particular, we have seen commitment to this policy waver over time, and we seem to keep getting stuck, particularly during the implementation phase. As such, AIMS is keen to see increased collaboration across the third sector to ensure that we are being properly heard and to help make this policy a reality. So what will Mary and I be covering tonight? Next slide, please. Well, this presentation follows on from an open access article that Mary and I wrote for the Practicing Midwife back in March, and you can find the link to that in this evening's resource list. I'll start by telling you about the Maternity Continuity Network, who we are and what we do. Then Mary will explore why third sector and individual service users support midwifery continuity of care, our interest in policy and implementation, and our interest in research and evaluation. And finally, I'll wrap up with some conclusions and suggested actions for us all. Next slide, please. So, what is the network? The network is a collaboration of 14 charities, networks, or community interest companies active in the UK, plus a number of individuals active in the promotion of midwifery continuity of care. And you can see the organisations we work with here. We're delighted that one of our members, Zainab, is here tonight, sharing the stage with us to talk about MVPs. And I was very pleased to see that another one of our members, Sandra Igwe, is currently in Cape Town at the International Maternal Newborn Health Conference. So I can't wait to hear from her when she gets back. Now, Mary convened the network at the end of 2021 in her role as an independent but very well connected volunteer, when it seemed that the rollout of continuity of care across England was increasingly under threat. And I've been supporting Mary and will take over the role as network convener in July. During this period, Mary and I have been very lucky indeed to work closely with Leslie Page, who many viewers will know as our much cherished midwifery advisor for the network. As a network, we meet regularly and often. We include external speakers at our meetings to deepen our understanding, to exchange intelligence and perspectives, and to connect and support each other in our individual efforts to help make this policy goal a reality. We have an ambitious action plan for 2023. What's perhaps most interesting about our network is how we all come together, each with our own particular focus and interests as a community of interest. Next slide, please. You can see on this slide here some of the different goals of our network members. So there is no one organisation in the UK dedicated to maternity continuity of care, but we hope that our network, bringing together a range of perspectives, is a good substitute for that. And indeed, from our very first network meeting, we started to understand just how powerful it could be to come together, to support each other, to promote a policy that we all strongly believe is foundational to the improvement or transformation of our maternity services. Next slide, please. Just look at Chaya's reflections here, for example. Chaya is what's called a service user voice for NHS England, as well as being involved in the Maternity Voices partnership structure. As Chaya's words illustrate so well, our network meetings give us all space to reflect on the importance of continuity of care and maternity, and to deepen our resolve to have it implemented, if only for the generations that come after us. So over to you, Mary, with the next slide, please.
Thank you, Jo. So I just want us to focus for a little while on what a momentous thing it is for a woman to become pregnant, to contemplate labour and giving birth, and becoming a new mother and all that goes with that. It's a huge life change. And I think that because we see mothers and babies around, and for those of us working with mothers and babies every day, we can sometimes forget just how huge that is in a woman's life. Relationships matter to people, and as that's the case at this really important time for a woman or a birthing person, having support from somebody familiar who's there throughout the journey is really important. We know that things can change at any time very suddenly, and sometimes differently. There can be a few niggles that woman has that she might think something isn't quite right, but they seem small things. And if she's got somebody she feels that nothing is too small for, it's much easier to raise those concerns, particularly during the postnatal period, but also if you're anxious at any time or you're uncomfortable, sleep is disturbed, feelings are heightened. And women need proper support and someone to turn to. They need to be listened to, and they need to be really heard, and to have someone who understands them and their situation and their values, that they can prepare and plan together with. Next, please. So we've heard about the network, a few little indicators. Some of the people that continuity is really important for are those women who have the toughest deal, the most challenging social circumstances. So Ros Bragg at Maternity Action has highlighted how important it is for the really vulnerable women, such as the migrants and asylum seekers who are away from their own country and really in challenging circumstances. And Laura Rose from LGBTQ plus Mummies has really emphasised how for marginalised and minority groups, continuity of care is crucial in order for them to feel better understood and supported and safe. We I hope and think are all aware that Black and Asian women and other minority groups have seriously poorer health outcomes, and the Birthrights charity who worked with us, who facilitated the inquiry into racial injustice, have highlighted that awareness of cultural issues and the kind of discrimination those women can face is really important. And we would be saying that awareness and examination of people's values and the way they behave, alongside access to continuity of care, is really, really important for that group of women. The two need to go together. And then Tanis, who we have worked with, I have worked with a lot, has said for somebody like her with complex medical and mental health issues and the sensory needs associated with being on the autistic spectrum, means that continuity is important. And she puts it, not getting that or having it taken away is as serious as catastrophic to her. And she talks about the challenges of navigating the system of care being sufficiently complex to result in her avoiding seeking help and self-medicating with whatever she had already available to her. So we get a little glimpse of some of the consequences. Next, please. And then in addition, for, all women contemplating pregnancy, and I'd just say, pause a minute and just think about your own daughter or your friend. If somebody you love was newly pregnant, what kind of care would you want for them? The woman on the right on my screen, Tina, is a dear friend of mine, and her daughter, Lizzie, in the middle here, who went to school with one of my sons, had a baby last year. And I talked to her and listened to her a lot, and she told me about what mattered to her. And she didn't know much about maternity care until she got pregnant, which I think is true for many women. But then she read up about, a whole lot of things. And she decided she'd book for a home birth. It seemed to her to be the obvious and sensible thing to do. And that way she got continuity from the home birth midwives. And she said her main midwife was kind, compassionate, and incredibly knowledgeable. And she enabled her to feel an increasing trusting bond, and it helped her to feel utterly safe in her care. Now, Lizzie transferred to have her baby in hospital, but despite that, and unfortunately for her, and it was a real loss, she didn't have care from her known midwife because it wasn't an integrated team, it was a separate home birth team. But despite that, having that relationship, she felt, she says, I honestly believe it contributed hugely to my straightforward and positive birth. And being able to debrief a whole lot of things and get help with feeding afterwards was very, very important to her. Next slide, please. So Jo and I and the network are very much of the view that continuity is really vitally important for both physical and psychological safety for women. And if you haven't seen it already, we would really encourage you to watch this video produced at the LEAP midwifery team, and this one is the one of women talking about their experience. It's very motivating and moving. So in our paper that Joe mentioned, we say women want to feel safe and cared for with the knowledge that they have someone they can approach without feeling anxious about possible negative effects of initiating that contact. Next, please. And I just draw your attention to the NHS Constitution for England. I don't know how many of you are familiar with this, but it does make it absolutely explicit that the NHS belongs to the people, and patients should be at the heart of everything the NHS does. And services should enable people to promote and manage their own health and have their needs and preferences met together with those of their family and their carers. So people have a right to expect that NHS bodies will monitor what they provide and work to improve that service continuously, improving safety, effectiveness, and the experiences of service users. And it's challenging, we know, at the moment, but we need to be keeping that goal in mind. Next, please. I'm pleased to say that whether or not you're immediately familiar with that constitution, Amanda Pritchard, the CEO of NHS England, is very aware of it. And she hopes that, as well as having high expectations, we'll understand the challenges faced by the services at the service at the moment, the NHS. But she points out very clearly here, without the insight from people who use services, it's impossible to make truly informed decisions about service design, delivery, and improvement. So a really useful touchstone to take with us. Next. So we've heard about lived experience a little bit and public voices and our NHS constitution. So I'll now just touch on the research evidence. I think the people attending this maternity and midwifery hour are probably very familiar with the Cochrane review on continuity models of midwifery care by Jane Sandel and colleagues. It was published in 2016, and there's going to be an update this year, slightly different focus, consistent with ongoing thinking. But the summary of that was that models of continuity were less likely, women who experience models of continuity of carer were less likely to experience intervention and more likely to be satisfied with their care. And the outcomes for the women and the babies were at least as good as for comparative models of care. Now, I've also put some other things in that box about doctors' care, which I'm going to turn to in a sec. A couple of references on women's experiences from research, and this study from Alison Cummings and colleagues from Australia, which looked specifically at women who had a history of of serious mental health problems. And that study was showing fewer preterm births for that group of women. So there's increasing evidence with all the years that go by. Next slide, please. So you may not be so familiar with this because it's just outside midwifery and maternity care, but patients who have had care from the same GP or specialist doctor have been demonstrated to have lower mortality rates. And the feeling is that's probably due to greater accumulated knowledge and a better understanding of the doctor and the patient of each other's views and priorities, leading to greater satisfaction, improved health promotion, more adherence to whatever medications being prescribed, and reduced hospital use. So there is evidence from a range of sources. Next slide, please. So all of that is a kind of background to the policy that we have to implement midwifery continuity of carer so as to deliver safe and personalised maternity care to all those women going through this huge life-changing experience every year. And the idea is to deliver it to the vast majority of women. But as we've heard, there have been some interruptions to the opportunities to implement that. We all know about the COVID pandemic. We've also had Brexit, which has been one of the contributing factors to our challenge with staffing across the NHS. Next slide, please. So although we haven't got there yet, and targets were put back and they have been suspended in the last year, our aim is still very much that that is the vision for maternity that we need to hang on to. And I think one of the things we've learned since 2016, when Better Births was published, is that there's a good deal of preparatory work and planning that needs to be done for a major transformational whole service change. And many things have been done with a national lead and regional leads and very practical guidance documents for people planning at local level. And I'm pleased to say that midwifery continuity of care is prioritised as one of those 5 areas of healthcare that should be focused on as a priority for the 20% of people living in most challenging social circumstances in areas of highest social deprivation. Next slide, please. So, because it's a challenge, not surprisingly, people have developed really quite detailed training and models of how to deliver this kind of service change. But I'm not sure that we were as prepared as we might have been in maternity to put these in place several years ago. But if you're interested and wondering what you can do, you can have a look at taking one of these courses. There's a lot of really interesting stuff out there, accessible online a lot of the time. But also in research, there's this whole science of implementation science. And King's College, where I do a lot of work, does day courses, but also short courses. And that can be really helpful too. So well worth looking into. My final slide before handing back to Jo next is the slide on research and evaluation. So there are a lot of questions about implementation and how best to do it. And people have questioned how much evidence there is. So NHS England have commissioned a rapid appraisal of implementation so far in England, which has been delivered now, as I understand it, to NHS England, and that'll be in the public domain very shortly. And then there are 2 pieces of work that the big national funder of health services research, NIHR for short, have funded through an open competition. And Manchester University are going to be, or have started doing a rapid appraisal of enhanced midwifery continuity of carer, where they've put in additional funding for services delivering care to Black, Asian and minority ethnic women and women in high areas of deprivation. And there's a longer term study that will report in 2025, where Plymouth, Cardiff and Birmingham universities are working together. And we know from a recent meeting that they're intending very much to continue the kinds of approach that have been used by City in their rapid review. So lots in the pipeline, lots to look out for that will help inform where we go next and barriers that need to be overcome. The scoping review, which is highlighted here in blue, published in October 2022, and that was also commissioned by NIHR, and it was following a particular point raised by the Ockenden report. Next, please. And it found only 5 studies looking at midwifery, continuity of care with close collaboration with obstetrics. There are only 5 studies across the world, 11 papers. So the numbers were also small, nothing on outcomes at all. But in order to set up those schemes, good partnership working between midwives and obstetricians was really important. And the barriers were service pressures, lack of funding, and lack of management support. And I think the need to get management on side is coming up in many quarters. And only one of the studies, I believe, I'm right in saying, came from the UK, and that was the Poppy trial. And some of the findings from that were that for women, the intervention was associated with feelings of increased trust in their midwives, greater perceptions of safety, more involvement in care decisions, and positive experiences of bonding with their babies. So I'm afraid that was a whistle-stop tour, but back to Jo. And the next slide, please.
Thank you. So to start summing up with some key points, our commitment is to support the implementation of continuity of care in the maternity services. In doing so, we also recognise the need to tackle staff shortages. We commit to being a critical friend to NHS England and to the wider implementation team. We feel that the network in drawing together and multiplying interests, knowledge and skills is a key asset in the implementation of this long-awaited maternity transformation. But we can all play our part, and we would like to call on everyone listening to help us. Next slide, please. We can all contribute to the growing evidence about why continuity for all really matters and how it can be implemented for the benefit of all. We would like to encourage you to keep collaborating and talking about this policy priority. We have found videos to be a particularly useful way of communicating the benefits of continuity. And the video Mary mentioned earlier, we have a link to that in our resource pack tonight. We would love to share any videos you have produced. And in sharing progress updates and stories, we can each help more people understand why this is a policy priority that is here to stay until it is delivered. So that just leaves me with a few final points. My next and final slide, please. You can find the references from this presentation on a further final slide, which is available as a PDF in the resource pack. Please feel welcome to contact us, including if you'd like to have a speaker slot at one of our network meetings, but also if you'd like to liaise more informally. Please tag relevant posts about continuity of care. We don't have network social media accounts, so tagging your posts clearly will allow us to find and share them. We hope that you've enjoyed hearing about our work. Thanks very much for listening. Back over to you, Sue. Thank you.
Thank you. Thank you, Mary and Jo, both for packing a lot in the presentation. Fantastic. I don't know how you did that. Fantastic. Okay, well, I'm going to move very swiftly because, of course, this hour, and I've said this to Zainab earlier, this goes faster than any other hour in my whole life. And I don't want to lose anything. So I'm delighted to welcome Zainab Barry. And she's a political scientist and international development specialist. And she's currently a director at National Maternity Voices, a public member of the Health and Social Care Delivery Research Programme Funding Committee, and an NHS peer leader and strategic advisor for NIHR Applied Research Collaboration at the King's College, London. So welcome, Zainab. The screen is now yours.
Thank you very much, Jo. I'm just waiting for my slides to be uploaded as well. And well done for your brilliant presentations, Jo and Mary. Well done.
Thank you.
Welcome. I'm hoping that the slides will be up in a few seconds.
Yes, the tech, it doesn't speak as quickly as that, but it's coming. It's coming.
Yes, here we are. Thank you very much. And once again, good evening, everyone. Thank you for inviting me to share this platform with you tonight. It's always an honor to be given the opportunity to talk about maternity services and maternity versus partnerships, especially when it comes to highlighting their importance within the maternity world. Whether we want to ensure that maternal health services are more equitable, whether we want to find out the best way to implement continuity of care, or whether we want to devise new policies or services, listening to service users is vital. It is therefore important for trusts to effectively collaborate with their maternity voices partnerships, whose main role is to ensure that the voices of service users are heard, championed, and taken into consideration in all aspects of maternity care or service provision. With that being said, tonight, my aim is to really try to shed some light into the primordial role that maternity voices partnerships play within the maternity realm, highlight the importance and call for better and more effective collaboration between them and other key stakeholders in the maternity sector. So, with your permission, let's begin by defining what maternity services or maternity voices partnerships are. Next slide, please. Thank you. As noted on National Maternity Voices website, a Maternity Voices partnership is an NHS working group, a team of women and their families, commissioners and providers, midwives and doctors, working together to review and contribute to the development of local maternity care. In the sense, a Maternity Voices partnership is a bridge that helps to connect healthcare professionals with service users. It's a critical friend whose main aim, as mentioned before, is to help champion the voices of service users by closely collaborating with healthcare professionals and creating platforms or environments which would then enable service users to share their experiences, perspectives, recommendations, or actively take part in the shaping of their respective local maternity services. They are usually run by mothers and other local service users who are passionate about improving maternity care and services for all. Next slide, please. Thank you. So why are maternity voices partnerships important? The important role of maternity voices partnerships cannot be overstated. Throughout the country, MVP chairs, co-chairs, volunteers, and healthcare professionals are working tirelessly with passion and compassion to ensure better maternal health and care for all. Maternity Voices partnerships collect feedback from service users, either via email, social media, surveys, or face-to-face. They hold listening events targeted at specific groups. They conduct water patch events where they collect direct feedback from service users, appreciate the environment in which care is being provided, and talk to healthcare professionals for further information. They do 15 steps and sometimes collaborate with local community organizations to gain deeper understanding of the needs of service users within their geographical footprint. They also provide recommendations, invite service users to be agents of change by empowering them and allowing them to express themselves within psychologically safe environments at various meetings. Also, as mentioned by the NHS, Maternity Voices partnerships focus on closing inequality gaps. They listen to and seek out the voices of women, families, and carers using maternity services, even when that voice is a whisper. And they enable people from diverse communities to have a voice. Maternity Voices partnerships, or MVPs, are doing a great job and need to be encouraged and supported in all relevant sense of the term. I therefore welcome the fact that within the NHS 3-year delivery plan for maternity and neonatal services, the importance of maternity voices partnerships or maternity or neonatal voices partnerships, as they are now being called sometimes, is recognized, and that there is a commitment to fund them appropriately and support them as needed. Donna O'Condon, the author of the O'Condon report, also stated that it is imperative that family voices are strongly and effectively represented in each LMS, so local maternity system, through the maternity voices partnerships. So all in all, MVPs are key stakeholders in the maternity sector, and working with them effectively is of utmost importance. Next slide, please. Thank you very much. So my message to midwives and commissioners tonight is to listen to service users. Ensure that you involve your MVPs at all relevant meetings and with all service and policy development opportunities, and support them accordingly. Focus on ensuring that co-production, as opposed to mere consultation, is a reality at your trust. Create trusting and psychologically safe environments in which MVP chairs, co-chairs, and other service users can thrive. Empower your maternity voices partnership team and help make their work and impact more visible. Invest in training, and this is always a plus for everyone. Know that you're in this together and that MVPs or MNVPs are there to support you deliver better maternal health care and services for everyone. So collaboration, not unhealthy competition, is what should be done. Try to develop a positive rapport with your MVP. Address barriers to engagement and participation effectively. It's really important to understand why some groups of people are not well represented in decision-making processes, and thus adjust your policies and strategies accordingly. Finally, please remember that an imbalance of power between MVPs, service users, and healthcare professionals can hinder effective engagement. Therefore, it is always recommended to address this to ensure that there is an equitable share of power between all stakeholders, and that a strong emphasis is put on respectful interactions. MVPs are your friends, your critical friends, who are there to help you champion the voices of service users. So working with them effectively will only help you achieve a goal of delivering good maternal health care and services for all. I believe that's it from me. Next slide, please. Thank you very much, everyone, for listening to me. I'm now going to hand it back to Sue. Thank you very much.
You're handing it back to all four of us. Thank you so much, Zainab. That was really good. And I think the what was coming through for me with all of the presentations actually was the listening. But I love the critical friend, and I guess as I was hearing that, I was thinking sometimes we don't want to hear our friends telling us things. And that may come out in some of the questions. Now, I'm just saying to our audience, if you have any questions for our guests, please do send them in. They'll come through, and that's why I'm looking away every now and then, because they come on my other screen, and I can field them to our guests. I have had a question from Ola, and I think this might be one for Joe. I'm not sure. How can we, and hi Ola, sorry, I should have said hello. How can we as students maintain continuity by working with the same midwife in a particular unit? Like if a student is in antenatal ward, they can maintain one midwife, so enable us to consolidate our learning. Working with different midwives tend to confuse some students. I think that's quite a complex question. focusing on continuity. I don't know if anyone wanted to comment on that. It's kind of feels like that Ola is sort of bubbling up with frustration here.
Yeah, I could say something about that, Sue. I think we're helped here in the UK by the NMC, our regulator, being very clear that students need to become very familiar with continuity of care, because it is the policy direction we're moving in. Then it's left to higher education institutes, the HEIs, to really work out with their placement partners how to put this into practice. And I wouldn't underestimate the challenges involved there. But I think we've heard really powerfully from midwifery educators on Midwifery Hour over the years. And I'm remembering back to a session Anna Byram gave, must have been at the end of last year, about how different universities are really bringing continuity into the center of what they do and supporting their students. So ask the questions at your university if it's not delivering for you at the moment as students, but also when you're applying to study midwifery, make sure your university that you're looking to study with has really got the message that women want continuity, and that's the direction of travel, and they're going to support you in equipping you for that future.
Fabulous. Thank you, Jo. I think many students may be aware of the NMC standards. This is sort of our Bible for us educators that helps support every curriculum, every program. And the NMC, who published it in 2019, made a very firm commitment about the requirements for students to learn continuity. But what's important is this is standards of proficiency for midwives. So if you're an existing midwife, those proficiencies are for you too. It's all available on the website. But thank you, Jo. That was fantastic. Fantastic answer. And we have Jill Moncrief, hi Jill, who says, can we think about ways forward to make continuity of care work for everyone? As it is, sometimes it doesn't seem to work for all. How can we find out what works best for all for continuity of care? Maybe that's one. I don't know. Zainab, would you have a kind of view on that one?
Yes, thank you very much for that question. I think what I've realized over the years with my experience with MVPs and different service users is that it's important to ensure that we personalize care. So it's different to generalize, but I mean, and that's actually one of the pluses, the advantages of continuity of care, because you have this team of midwives or healthcare professionals who are there to listen to you and ensure that your needs are catered to, and that so basically, so it's going to be personalized to you. So is you going to receive the type of care that is important to you, how you wanted to, to go through your maternal journey. So really the key word there, as you say it again, is to listen, is to really listen to the service users and ensure that the policies and the services are given to them or developed in a way that responds to those needs. Thanks.
That's fabulous. I mean, I think what Mary was saying about thinking about what you'd want for your sister or your friend or your daughter was a good point, because I think if you think anyone who has had any contact in the NHS, because we're used to it, we're used to the complexity of it, and when you go, I noticed it when I went into a strange hospital a little while ago, and it felt completely alien. And I'm used to hospitals. I'm thinking, well, where am I meant to go? Where are the signs? The signs are different. And what made a difference to me, funnily enough, was a nurse who smiled at me, and I thought and said, "Are you okay?" Which was like a very simple thing that starts things off. But thank you, Jill, and thank you, Zainab. That was lovely. And we have Angela Stringfellow. Hi, Angela, who says, we have a great relationship with our MVP. Yes. Co-production is key. My question for Zainab is, how do we reach the hard-to-reach communities to ensure their voices are heard or their voice is heard? Fantastic question, Angela.
Thank you so much, Angela. That's a great question. So I'll refer to something that is, oh, I can see you smiling, Mary. That's yeah, so we recently conducted a listening event in Lambeth with Mary and other service users and peer researchers and researchers at King's College. And what we realized was that, the confirmation of the fact that people are really not hard to reach. It's the services that need to be adapted, So basically it's about going into the community, listening to service users, looking into the organization itself and saying, what are the barriers to entry, basically? How are we, projecting ourselves to others? What is happening to us? What are we doing that is not inviting them in? So we go to them, we go to the service users, and we ensure that we build a rapport, which is what I talked about in the presentation. Just having that human experience, being candid, and the smile that you referred to, just being us, just being human. That's what we need, to ensure that more and more people get involved into not only, just not only in the MVP, but also in research and, the whole maternity, journey to ensure that there's more equitable care for all. I hope that answers the question.
I think so. Mary?
Can I come in and make a comment?
Yes, you can. Please do.
About those three lovely questions. So
yeah,
I'll go in sort of reverse order. As Zainab has just said, we held a wonderful listening event with local women who live in Lambeth just a few short weeks ago. It did take a lot of organising though, and I think people have to invest, and sometimes MVPs are expected to do quite a lot of outreach without really being given the resources that they might need, or the support and help that they might need, and each case will be different. Holding an event with nice hot lunch in a community centre, which is just a sort of pram push from where a lot of people that you want to talk to live. It's a great thing to do, and you need to use all your networks and contacts, the people that women trust already, to be the intermediaries, because people have a trusting relationship, then they will show up. Back to continuity again. So it looks easy when it's done well, but it takes a lot of really careful planning, but it can be done, and it's all about what Zainab was saying, showing up, being yourself, and relating to people in a human kind of way. But I also wanted just to comment on Jill's question about implementing continuity so that it kind of works for as many midwives as possible. I think there are real challenges, and different settings, city settings or rural settings, working out how you can model things. It's not straightforward. It might mean that you need some cars that can be rented, or some, I don't know, mopeds that can be rented, practical things, or there might need to be some shared childcare. There might need to be some, admin support, so the midwifery time is being used for midwifery. But I think that's picking up on Joe's point about learning from each other and communication. Sometimes people really kind of crack the code and have some great learning, but we don't necessarily share it as widely as we could do so. And I just wanted to say, in relation to student midwives, before people have a lot of caring responsibilities, it's really handy for people to be able, in that part of their career, to be involved in continuity caseloads and teams. And so it's vitally important that all students have that experience when they're training. And we won't kind of crack the staffing and the workforce challenges and those who are really keen to do continuity model if we don't make it possible for all students to experience that. And those that do seem inevitably to say it's so rewarding and so motivating that they want to do it again. But we need to have enough caseload and team midwifery in place in order that all students have somewhere that they can shadow a midwife and learn about doing midwifery in that kind of way. So it's you know, it'll help us all if we can make that happen.
Well, I think that, I mean, that's why in a way it was built into the NMC standards. But I'm aware of several education institutions who have developed caseload holding for students, like in UCLan, for example, which makes sure that the student is following through the women. I wonder if that balances, because I sometimes get the feeling, and I don't know what the view of my lovely guests might be, that it's almost like continuity of care has got a bad press somehow, and yet we'd all like it. So, but there seems to be people think it's just too hard, or it restricts your practice too much, or it makes your life harder. And yet anyone who's done it has a different view. And how do we address that with a user focus?
That's a beautiful invitation to just mention that video from midwives, as well as the one from women from LEAP. That there's one there of midwives talking, and I know other people have made them too. And it is, as you say, when midwives have done it, I mean, there are those who've got caring responsibilities, or they've got the travel is a challenge for them, and those are real issues that we have to pay proper attention to and think about how they can be addressed. But people who have done it really find it enormously rewarding. And of course, we've heard from the Northeast that midwives' sick leave goes down when they're working in that way. So it seems to be the case that the pressures and the stresses are reduced, because you're going out to women that you know and families that you know and care about. So it feels more meaningful to the midwife as well as to the women and families.
I'm just Joe, would something from Joe?
Thank you, Sue. Yeah, if I could come in here. Let's not forget, this is called a transformational policy, continuity of carer. I think no one underestimates the challenges involved of bringing this transformational change in. It's a whole systems change. It involves everyone in maternity care, whether or not you're on the front line as a continuity of care and midwife. It involves the obstetricians, it involves the GPs, it involves everyone in the local healthcare service. But not just that. I think we really do recognise too, as the sort of consumer lobby for this, that for many midwives, it is a huge shift in the way they've been working over sometimes decades. It's a huge shift in the way a midwife might conceptualize of herself and her role. We are asking for change, and that is hard. And I would simply mention here the fantastic work that's been done by Jackie Dunkley-Bent, who we had on last week, in terms of bringing in leadership that wants to support that change. Because I think with strong leaders from the national level down, they will be able to support each member of staff in finding their own pathway through this transformation ask.
Fabulous, thank you. And Zainab.
Thank you. I just wanted to say that, yes, continuity of care seems really, well, it looks really challenging, and it is, as Joe just confirmed here. It looks a bit like a utopian dream. But I think with the right support, the right funding, it is achievable. We just need to find out how, what's the best strategy to get there, basically. Thank you.
Beautiful, wonderful. Now I'm just going to make some comments from our lovely audience, who are always so fantastic. And we have, first of all, Lisa. Hi, Lisa, who says, hi, disappointing to hear that need to get managers on board. Managers are on board and find it extremely difficult to deliver this given the national shortage of midwives. Well, that's true. And I think we've got the balance here. This might be from an earlier comment we made. We are on board, but as many units are receiving inadequate CQC ratings due to lack of staff, and that is a point. And I know that in areas where they haven't got sufficient staff, one of the things that Trixie Macquarie always says is you can't do it until you've got the staffing right.
Absolutely.
So that's it. And then Chaya, hi Chaya, says the problem and challenge with engaging with seldom listened to communities is that we're often asked for our opinions, but nothing ever happens with the information we share, starting with meeting where people are, offering lunch and gift vouchers in return for time is a good start. And that reiterates what Mary mentioned a little bit earlier. Thank you. That's a lovely comment, Shia. Thank you. Absolutely. I think one of the things I'm going to take from this, if I was doing my little reflection for my revalidation, it would be listening. This is one of the key things, apart from relationship, is the listening and really hearing as well. And then we have another comment, two more comments now. Claire Elliott. Hi, Claire. Continuity care gets bad press because of the staffing issues to run it safely. If we had full staff, it would implement so much better because it could be staffed well. We have to sort out our recruiting and retaining first. It's a huge process. And it may be chicken and egg, of course, because if the midwives are happy, not only will they not get sick, they won't leave us. And then we need to keep them. And then final comment now, and because the hour has come to an end, as most of you will have noticed. Thank you for tonight's presentations and your valuable perspectives. They're extremely useful for me as a midwife practicing within a maternity care system, crying out for more continuity of care. And that's Nora Vallejo. So thank you, Nora. And you had the last word. So thank you for that. And thank you to our lovely speakers who opened the door on the whole issue of really listening, maternity care partnerships, and really getting this agenda forward. So thank you so much for giving us this. And we must invite our guests again, because I think this is a story that we need to return to and really weave through a little bit more. So thank you for that. Now, because we've come to the end, as I say my thank you to my lovely guests, I'll also say a big thank you to Angelo, who's behind making sure everything's going to be edited beautifully and recorded forevermore. And also Deborah for making sure everything's coming through okay, and Paul, who makes sure I got all the questions. Resources will be available on the website and on Facebook on Friday. And for those of you who like a 6 o'clock in the morning podcast, it will be ready Friday morning. Okay, next week on Maternity and Midwifery Hour, we're going to be talking about baby loss. And I talked about that a little tiny bit earlier. But this is about supporting Black and mixed Black women with after baby loss. And we've got Alicia Burnett, who many of you will know, and Amina Haishia from Tommy's also will be with us. Okay, and also don't forget Midlands Festival is next Tuesday. So if you haven't booked and you want to either come up to Leicester or listen online, do book for that, or Cardiff on the 12th of September, and that's for Wales and the Southwest, and it's going to be really fantastic. And in the meantime, stay safe, stay well, and we'll see you next week. Same place, same time next week. Take care.